Hello everyone, this is Shu-Ting Lee, a speech pathologist. Welcome to Video Atlas of Cleft Lip and Palate Care. Language development for children with cleft lip and palate is one of the issues that many parents are concerned about. Parents may worry that children with cleft lip or cleft palate will have trouble learning language and speaking clearly, and that their children's social relationships and self-confidence will be affected if others do not understand what they say. In fact, children with cleft lip and palate can have good language development. Even though they are still at high risk for delayed language development due to some congenital conditions and acquired factors, most children with cleft lip and palate only have oral structure problems. They may have an articulation disorder, such as
1, 2, 3, 4, 5
becomes
1, 哭, 回, call, cut.
And hypernasality, such as
1, 2, 3, 4, 5.
But these don't affect the brain's ability to learn language. As long as the organic defect is repaired properly, they can have normal language development of speech like other non-cleft lip and palate children. Parents can play interactive language activities or games with their children during their early years to stimulate better language learning and articulation skills. Speech development in children with cleft lip and palate is mainly affected by the function of the soft palate and hearing. 1. Soft palate function means that the soft palate must be lifted up and back to separate the oral cavity from the nasal cavity when we speak, so that there is enough airflow in the oral cavity to make sounds, such as
p, 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 c, c, c.
However, in some cases, even after the first palate repair surgery, the soft palate can't block the nasal cavity completely, resulting in oral airflow insufficiency or overuse of nasal resonance while speaking, such as
ha, 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 he, he.
That is called velopharyngeal insufficiency. 2. Hearing refers to the fact that children learn to speak by clearly hearing the sounds of others and the environment, as well as learning to speak through imitation and self-correction, all of which require good hearing. However, children with cleft palates are more likely to have middle ear effusions or otitis media, which will affect their auditory function, leading to articulation errors and then affect overall language learning. Since soft palate function and hearing are the main factors affecting the speech of children with cleft palate, the effect on speech development varies by the type of cleft lip and palate. In Type 3, Type 4, and Type 5, which are with cleft palates, about 15 to 20% of children will have hypernasality after palate repair, which will affect their articulation performance. They will need another repair surgery so the soft palate can have enough function to produce proper speech. We know that children with cleft lip and palate may undergo several surgeries, as shown in the figure. There are 2 surgeries related to speech. The first surgery is the palate repair surgery done at 9 to 15 months of age. This surgery is needed for every child as long as they have a cleft palate. If this surgery is delayed, children may miss the optimal time for speech learning and affect their eating efficiency. Some children only need this surgery, but a small number of children will need a second one. The second surgery is to correct velopharyngeal insufficiency, VPI, which is performed at age 4 to 6 years old. About 15 to 20% of children who have a repaired cleft palate will have persistent VPI. In VPI, abnormal speech is due to abnormal structure, and surgical correction of the anatomy is indicated. For these cases, speech therapy cannot improve hypernasality, nasal emissions, or weak oral pressure of oral consonants, even though there is only a small gap left in the palate. This may get worse instead of better with age. Whether these children have undergone palate repair surgery or haven't started talking, parents can help them learn speech through some parent-child activities. I will introduce the activities that parents can work on with their children before the palate repair surgery and after the surgery. Prior to palatal repair. In general, infants and toddlers will make the most sounds in familiar environments, so parents should try to provide positive responses to all the sounds made by their children in their daily lives. The goal is for children to enjoy making sounds, to get others' attention, to interact with others, and to express their needs, etc.
Old MacDonald had a farm. E-I-E-I-O. And on his farm he had a pig. E-I-E-I-O. 好吧。
You might simply use the same phrases, such as singing or nursery rhymes, to help identify speech patterns and transitions. For example, Brother John, are you sleeping? Or Old MacDonald had a farm. Then you can use the strategy pausing to not only give them opportunities to respond, but also to give them something different to anticipate. It may increase their willingness to make a sound.
1、2、3，哇！1、2、3，你的哇嘞？1、2、3，哇！哦，这个很棒，哇！哎，好，很厉害。
Play peekaboo games with children by leading them to make the meow sound and imitating their voices, or modeling different sounds, playing a back and forth sound game with the children. For example, if the children say b, you can imitate their voices back to them, and then wait to see if they imitate it again.
很棒，再试一下，嘟，好棒，一个哦，预备起，嘟，一个，嘟，嘟嘟嘟，棒，好，预备哦。
Add meaningful actions to their verbal output, saying papa while driving the toy car over, or saying pop when the bubble pops while playing a bubble blowing game. Pop, pop, pop. After palatal repair. Children can learn pronunciation skills while learning words. It is recommended that parents encourage their children to use pronunciation skills they have already developed to learn new vocabulary. Using pronunciation games, incorporate phonics into your everyday life so that you can help your child be a super successful speaker. For example, the b, p, m, h sounds are easy to learn, and parents can teach children to say papa or bell to learn the b, p sounds. Besides, t, d, and l are recommended for practice in the early stage. Parents can teach the vocabulary of 10 or t so that children can learn the pronunciation of t and use these words to express their needs. The following are at-home activities for parents to do with their children to help phonetic development or to prevent them from developing incorrect pronunciation habits. 1. Parents can demonstrate the sound made by the lips and tongue, but do not practice blowing intentionally. For example, you can stick out your tongue when taking a bath and say "loo-la-la, la-la-la-la," or say "yum" when feeding the children, or make a funky face in front of the mirror. And make a sound, then wait for the child to imitate you. 2. After the children have undergone palate repair surgery, parents can encourage their children to practice aspirated sounds, such as s and papa, and if necessary, pinch your child's nose, s, papa, to prevent airflow from coming out of the nose, but not to practice blowing.
我就不要，再一次，预备起，哇，很厉害，再一次。
Try different articulation positions. Games with lips. Do the kiss goodbye and say bye bye, or make a sound like p with your inflated mouth. Games with tongue. Stretching out the tongue and say liu liu, and sing nursery rhymes with la pronunciation. For example, la 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 la. Try different articulation methods. Plosive sound game. Imitate the whistle sound while playing with toy trains and deliberately stretch out the tongue to say doo doo. Or open your mouth widely to imitate a horn and say ba ba. Aspirated sound game. Put the straw in front of your teeth and say snake got into the hole. The sound of champagne opening. The sound of stir-frying. As long as the air comes out or there is a sound, the parents can first ignore if the sound is correct or not. If you hear throat sounds such as or sounds that do not normally occur in speech, such as please ignore it and demonstrate other sounds that children can easily make. When the baby is about 3 to 6 months of age, parents can provide complementary food as recommended and use different eating utensils, such as spoons, cups, and straws. It will help improve the baby's eating skills and practice using different oral muscles. If children are unwilling to cooperate with the games or activities or do not respond, that is fine. Do not force them because this is a game, not homework. The most important thing is having a speech and language assessment every 6 months by a speech and language pathologist. For children with cleft lip or palate, their first formal language assessment usually occurs between the ages of 2.5 to 3 years old. In general, children at this stage may have enough verbal output, and speech pathologists can collect more speech samples to make accurate analysis and diagnosis. Subsequent follow-up visits to plastic surgery clinics include a speech and language assessment by a speech and language pathologist every 6 months until the child enters primary school. It is also recommended for children to receive speech and language evaluations at any point before age 3 or whenever there are concerns about their speech performance. In this video, we talked about the language development of children with cleft lip and palate, the impact of velopharyngeal insufficiency on pronunciation, and some home practice activities. I hope this video can help children with cleft lip and palate learn better speech.